Welcome, and thank you for joining us for Exploring the Health Professions, a program sponsored by the Preprofessional Advising Office at Boston University. First, let's quickly discuss what will and will not be covered in this workshop. We are not going to be discussing much about specific professions. There are too many options, and without knowing individual interests, this discussion probably would not be helpful. This workshop is designed for students who know they want to do something health-related, but have no clear picture of what direction they want to go in. This workshop is not really intended for students who are certain that medicine or dentistry is the path that they want to follow. However, the information presented will likely still be helpful. What we will be covering is a step-by-step guide to identifying and exploring fields of interest to determine if a career is something you can be passionate about. First, we'll discuss how to identify possible fields of interest and explore how your values, strengths, and interests intersect with these careers. Second, we'll explore how to learn more about specific fields and to narrow in on those that look the most promising. Third, we'll discuss how to actively explore different fields to see if they are a good match. Fourth, we'll discuss how to evaluate and reflect on your experiences in order to make thoughtful decisions. And finally, we'll touch on considerations for professional school and how the Preprofessional Advising Office can help. So why are we here? Why is this workshop necessary? Opportunities in the health professions are more abundant than one would think. There are so many different careers within the healthcare field. But we have all been to the doctor, and in fact, you have probably encountered multiple doctors throughout your lifetime. However, you or someone close to you may not have ever needed the services of an occupational therapist or genetic counselor, so you may not even know what they do. There are a lot of careers in healthcare that work behind the scenes or aren't in the public eye. So, you're going to be a doctor, right? I bet a lot of you have heard that before. Oh, you're good at science? Why not be a doctor? As a society, in high school, etc., we really don't do a good job of promoting many health-related careers besides medicine. If you are good in science or enjoy it, you're usually asked if you're going to be a doctor. No one really asks you if you're going to be a pharmacist or an optometrist. When we are in hospitals or clinical practices, we often assume that everyone is either a doctor or a nurse, but there are many other players involved. At your primary care appointment, you may be meeting with a physician or a nurse practitioner or a physician assistant. Just among primary healthcare providers alone, there are these individuals, in addition to those who care for your teeth, dentists, those who care for your feet, technically they care for anything below the knee, podiatrists, and those who care for your eyes, optometrists. So where do you start? How do you begin to make a decision of which path is the best for you? This is where your journey begins, with self-exploration. So what do we mean by self-exploration? First, you'll begin by assessing your strengths and skills. What are you naturally good at? What types of skills do you possess that you enjoy using? Are you an extrovert that gets energized by interacting with others? Do you have a sharp attention to detail? Of course, we can learn and master many skills we practice, but it's important to also think about which ones we enjoy using. Great news! Our Center for Career Development has assessments that can help you get a better idea of your strengths and skills. Second, think about your values. The Center for Career Development also has tools to help you determine your values. What I mean by values are things that are important to you in your life. This includes things like financial stability, work-life balance, competition, helping others, prestige, etc. Keep in mind, you may not know them all right now. College is a time to clarify your values. Finally, your interests. Sure, you may be great at something, but does it really matter if you don't like doing it? So let's assume you do some exploration, and now you have a pretty good idea of your strengths, values, and interests. Now the question is, where do these intersect with health careers? How do you even begin to learn about what's out there? One place to start is with general directories. These are directories that provide some basic information about many different professions, including general responsibilities, job outlook, and educational paths to the field. Second, utilize your advisors in the Preprofessional Advising Office. They have many resources available to them to help you explore your different options. Finally, visiting the website of a profession's national association might be helpful. For example, the American Academy of Physician Assistants for PAs, or aapa.org, or the American Pharmacists Association for pharmacists, pharmacist.com. So now you have a few careers in mind. You have a general idea of what their job responsibilities are and what is required. Now you want to know what it's really like. Sure, there are casual ways to start to gain information, like unstructured conversations, secondhand information, but career exploration really deserves a more thoughtful and structured approach. But what if you are interested in audiology, but you don't know an audiologist? Or what if you still have important questions you want answered that weren't addressed on Explore Health Careers website or their National Association's website? This is where networking, informational interviewing, and other experiences come in. First, let's talk about networking. Networking is one of those words you've probably heard all the time but have no idea what it actually means. Networking is not going around introducing yourself to strangers and striking up a conversation. Instead, it's thinking about who you are connected to either directly or through others and using it to your advantage. Your web is larger than you think, sort of like 6 degrees of separation. If you keep talking about your interests to those you know, you will likely find someone who can connect you to a professional in your field of interest. Second, informational interviewing. You should do this. Informational interviewing is probably the most underused tool for exploring careers. Informational interviewing is not a casual conversation with someone in a field of interest. Rather, an informational interview is meant to be a structured conversation so that you can gain first-hand information and ask the most pertinent questions about a profession. But how do you find someone to hold an informational interview with? Again, you can use your network, which is likely to be the most helpful. However, you can also try contacting professionals in the area who you don't know already by phone or email. You may not get as many responses as you might through networking, but those who get back to you are generally very interested in sharing their views of their career. Additionally, there are excellent tips and resources available through our Center for Career Development and the Alumni Association. The BU Career Advisory Network is a tool through our Alumni Association that connects BU students, recent graduates, and other alumni. You can search for alumni within the field of healthcare by area. Additionally, they have a feature called Alumni Near You, where you can literally look at a map and pick out alumni that are in your area. Here are some examples of helpful questions to ask in an informational interview. So after doing some research, some networking, and we hope some informational interviewing, you may have narrowed your explorations down to a few career possibilities to pursue further. At this point in your exploration, it can be really helpful to now gain experience within a profession or a particular setting where you can experience more of the day-to-day of a specific career and what it really entails. Experience can also begin to build the exposure, knowledge, and skills you may need in order to move forward in a particular career if you choose to pursue it. For example, many health professional graduate programs expect an applicant to have some sort of clinical experience. Perhaps the most obvious way to gain in-depth experience is through volunteering and internships. There are few formal internship programs in the health professions, except those required as part of a degree, for example, a practicum. An internship is a formal, supervised experience in a field of interest. For pre-health students, this often takes the form of unpaid volunteer positions. Even with a volunteer position, you should have clear expectations of what you will be involved in and gain from the experience through a dialogue with your supervisor. If not what you expected at first, don't be discouraged. An institution may just need to get to know you better before giving you greater responsibilities. In-depth experiences can take time to build. And don't forget what can be learned just through observing. And speaking of observing, another great way to build a broader understanding of a profession is through shadowing. Shadowing is an inside look at the daily routine of a professional. In our opinion, long-term shadowing relationships are the best kinds of shadowing, as they provide you with regular contact with the profession and allow you to gain a very thorough understanding of the profession. One way I like to frame it is if I wanted to get an idea of what it was like to be a BU college student and I shadowed you for 8 hours tomorrow, would that be representative of your college experience? Probably not. If I shadowed you at different times throughout the semester or the year, I'd probably have a much better idea. Longer-term shadowing also opens up the possibility for seeing patients or aspects of the work that the professional wouldn't introduce to someone they are just getting to know. Shadowing can also turn into a mentoring relationship. A third way to build experience is through related research. Research can be more tangentially related to a profession, but it can still provide good exposure and help you to determine if a general area of knowledge is something that excites you. It's important to remember that one experience can be a springboard for another. You're building your knowledge, your skills, and your network with every experience you take on, which can lead to other opportunities later. Here's a brief list of resources to check out as you begin your career exploration. the Preprofessional Advising Office, the Undergraduate Research Opportunities Program, or UROP, the Center for Career Development, and your Profession of Interest's national associations. After having some in-depth experiences, it's time for the next step, reflecting on your experience. Experience alone doesn't do you any good if you do not take time to critically reflect on what you learned. Gut feelings are important, but when you are considering investing time, energy, and not to mention money into pursuing a career, you might want to have something more solid to go on than a hunch. Certain questions that may be helpful in your reflection are: did time fly by, or did you find that you were bored? How will the profession help you achieve or challenge the lifestyle you hope to have? Will the profession continually push you to learn more and offer new challenges? Are you willing to put in the time, energy, and money into additional education if necessary? And a big one, does the profession require a rigorous study of science? We meet with many students who express an interest in becoming a physician. However, they also express that they do not enjoy taking science coursework. If this is true for you, you may want to consider whether a science-heavy field is something you'll enjoy. On the flip side, if you are really interested in science but not in clinical care, you may not want to consider fields within healthcare requiring direct patient care. If you ultimately decide that you want to pursue a health profession, many of these professions first require the successful completion of professional school. Things to be thinking about in regards to pursuing professional school are, first, prerequisites. At most health professional schools, there is no consistency in academic prerequisites. Maybe some overlap in introductory science classes, but in general there's great variation in the required upper-level science classes. It's a good idea to create a spreadsheet of requirements at different schools so you have a graphic representation of those classes most commonly needed. Keep in mind that for programs with a high number of prerequisites, or with great variability, you may need to consider some summer or postgraduate coursework. Clinical or related experience. Some programs will require a significant amount of direct patient care hours prior to application. In some professions, the number of hours needed is so high that you may need to gain this experience after graduating, as it is not possible when you are a full-time student. Standardized tests. Determine what standardized tests are necessary, and remember, all standardized tests have an expiration date, usually within 3 to 5 years. Consider what other parts of your application, for example prereqs or clinical hours, you'll need to complete to time your standardized tests appropriately. You may also want to consider the demographics of the student body. For example, in some professions, the average age of students entering professional school is older. This is sometimes due to a higher level of expectation around clinical experience before beginning the program. As such, take time to consider whether or not you would be a competitive applicant at the end of your senior year. The application process is another important aspect to consider. Is there a central application? Do the schools use rolling admission? What recommendations are required? These are all things that are better to be thinking about now rather than later. Finally, it is also important to think about how you will finance health professional school. Most students pursuing the health professions can expect to take out loans. It is important to think about the implications of this, especially if you have undergraduate debt. Scholarships do exist, but they are rare. Accrediting websites of different professions have great tools for financial planning. We at the Preprofessional Advising Office can discuss some of the considerations of financing health professional school with you, and our Office of Financial Assistance can also answer more specific questions regarding loans, payment plans, deferral options, etc. So, who can help you with this process? First and foremost, the Preprofessional Advising Office. Though it's true that most students we see are pre-medical or pre-dental, we do have a number of pre-vet, pre-optometry, pre-physician assistant, and pre-nurse practitioner students as well. In many cases, health-related fields often require student and advisor to work more together. What we mean by this is that for some fields, you will not be able to come in and just ask a question and expect an answer right away. It may involve looking for information and resources together, and you might be asked to call some professional schools and then report back to us so we can guide you further in your next steps. In addition, each semester the Preprofessional Advising Office brings a variety of professionals to campus to talk about their various fields. These include physician assistant, genetic counseling, public health, nursing, and many more. Keep in mind that BU is also a big campus, so in some cases we might refer you to other offices and departments. These include the Center for Career Development and the Sargent College of Health and Rehabilitation Sciences. As always, for upcoming programs, make sure to check the Preprofessional Advising Office's calendar on their website, www.bu.edu/prehealth/calendar. Thank you for joining us for this presentation, and we hope to see you at upcoming Health Professions Series workshops.